Many employees in the janitorial field don't think of safety too often. In reality, they are the most important part of any janitorial safety program. Every day, workers in the janitorial industry come across unique and possibly fatal hazards. To educate you about the potential safety hazards you may encounter on a daily basis, and to help you train to perform your job duties safely, is the main purpose behind this training program. This program is not a comprehensive training program for each topic covered, but should be considered as an introduction of the topics covered. Its purpose is to provide an accurate but brief overview of the various topics discussed. Your employer will provide more in-depth training on the safety hazards and topics that require a more thorough knowledge. The contents of this video include the safety mindset, slips, trips, and falls, back safety, personal protective equipment, hazard communication, fire safety, electrical safety, and first aid. A good safety mindset starts with you. Your attitude towards safety can be the best preventative measure available to you. If you consistently think about safety measures as you perform your job duties and keep alert to your surroundings for possible safety hazards, you will help ensure your safety as well as the safety of those around you. When you spot a safety hazard, take immediate steps to correct the problem. This may include correcting the problem yourself or notifying your supervisor and/or other employees who can correct the problem. Never take shortcuts when doing your job. Sometimes, having the right attitude and following proper procedures may mean taking a few extra minutes to do the job right. This is the safe way to work. Slip, trip, and fall accidents occur frequently because situations that can lead to such accidents are all around us. Slips, trips, and falls are the most common accidents to employees in the janitorial service industry. Working in the janitorial field, you will often find yourself working in and around situations associated with slip, trip, and fall hazards. If you understand causes and take certain steps, you can minimize or avoid a slip, trip, or fall injury. Slips are caused predominantly by wet surfaces due to spills. Marking and cleaning up spills immediately will prevent many workplace injuries. Wet concrete or other wet floor surfaces can become very slippery even after a spill is cleaned up. Make sure you mark any area such as a bathroom floor that has been mopped so a fellow worker or another person is aware of the hazard. Not all slips are caused by the surface itself, but may be caused by the employee's shoes. Employees should wear slip-resistant shoes whenever possible, especially those who work in areas prone to be wet. The causes of trips can usually be easily identified. An object obstructing the view where one is walking, such as when carrying a box. An object in the path of normal walking. Hard-to-see walkways due to darkness or poor lighting. Clutter in the walkway, such as boxes or other items that should be picked up. Never put boxes or items in front of exits. Wrinkled carpet or loose-fitting carpet or tile. Cables or extension cords crossing the path, and uneven walkways such as doorway thresholds. There are several ways to prevent common causes of tripping. Remove obstacles from walking paths, walkways, and hallways. Keep work areas well lit. Replace burned-out light bulbs immediately. Rerouting or properly covering exposed cables that cross pathways, and straighten, repair, or remove flooring that is loose or not properly installed. You risk falling when working from any elevation. Falls can also be the results of slips and trips. Be careful when using any type of equipment that elevates you to a higher level, such as a ladder or a stool. Know the correct procedures for using ladders and don't use damaged ladders. Never place a ladder on uneven ground. Never work from the top rung of a ladder. Do not reach from a ladder. It is safer to get off the ladder and move it to a more appropriate position. Never use a box or chair to reach a higher level. When working on steps or stairs, use extreme caution and never leave tools or other items on stairs. Many janitorial workers place undue strain on their backs from mopping, vacuuming, and emptying trash, among other duties. To avoid back injury, stay physically fit and maintain good posture. Using proper lifting techniques can protect your back and you from injury and pain. If lifting is part of your job, proper lifting is a necessity. Bend your hips and knees, not your waist. Lift with your leg muscles, not your back or arm muscles. Avoid twisting. If you need to turn while carrying an object, turn with your feet first. Never lift a load higher than your waist. Always keep the load close to your body. If you need help lifting or moving a load, ask for it. Use carts, hand trucks, and other equipment when possible to move objects. Personal protective equipment, referred to as PPE, can provide a vital safety barrier between you and possible health and safety hazards. Don't take the use of PPE lightly. Working around various chemicals and with specialized equipment requires additional protection. It is important that PPE fits properly, provides the correct protection, is comfortable enough to perform the job, and is worn properly. Some of the more common items of PPE you may be asked to use are gloves, safety goggles or glasses, earplugs or ear muffs, protective clothing, boots and safety shoes. Gloves can protect your hands from spills, cuts, chemicals, and electrical shock. Proper safety goggles or glasses prevent flying objects and splashes from damaging your eyes. Normal eyeglasses are not considered safety glasses unless they're also protective safety lenses. Earplugs and ear muffs can protect your hearing when working with loud, intense, or high-pitched equipment such as vacuums, carpet cleaners, and polishing machines. Protective clothing protects you from chemical spills, heat, and sparks. Many janitorial service employees wear special coveralls or an apron. Boots and safety shoes can prevent foot injuries from falling objects, punctures, slips on wet floors, electrical shock, and heat. PPE must always be properly maintained to ensure continued and proper protection. Always check PPE for damage before and after it is used. Clean PPE before it is put away. Dispose of single-use PPE, such as disposable earplugs, properly. Avoid storing PPE in a place that could damage it due to heat, light, and/or moisture. Many workers store their PPE in an airtight Ziploc-style plastic bag. Employees who work with or near chemicals need to understand the procedures necessary to protect themselves. You have a right to know about the chemicals, the dangers they present, and how to protect yourself from those dangers. Training is necessary and required by OSHA to ensure the safety of all employees. Before using any chemical, always read the label. Make sure you are adequately protected by using the appropriate personal protective equipment. If you don't understand, ask your supervisor. Safety data sheets are required for every chemical used and must be accessible at the work site at all times. The safety data sheet is a 16-section, detailed informational bulletin prepared by the manufacturer or importer of a chemical. The safety data sheet provides information on the chemical, warnings, and appropriate PPE needed to work with the chemical. For consumer products such as window cleaner, toilet bowl cleaner, and dishwashing liquid, when used in the same manner and with the same duration and frequency that a normal household consumer would use them at home, employees should follow the safety guidelines printed on the container. Employees should take training seriously and pay attention. Make sure you know the correct emergency procedures and use safe work habits when dealing with chemicals. The best method of fire safety is fire prevention. All workers should take every step possible to prevent fires. Keep your workplace free of trash or other combustible materials. Do not overload electrical circuits and replace damaged electrical cords. Do not allow sparks or flames in areas using oxygen or flammable gases. Do not smoke except in designated areas. Fire prevention is important, but knowing what to do in case of a fire is just as important. Be prepared in case of a fire. Always call 911 if you see a fire. Know the location of all emergency exits, fire alarms, and fire extinguishers. Learn how and when to operate fire extinguishers. Remember, smoke and heat can be just as deadly as flames. Don't open any door without first testing the amount of heat radiating from it. Touch the door to feel if it is hot. If it is hot, do not open the door. Stay low on the floor and crawl if the walkway is filled with smoke. The air tends to have more oxygen closer to the floor. Remember that others' lives may depend on your actions. It is extremely important that you become aware of hazards associated with electricity. Examine all cords and plugs routinely. Do not use damaged equipment and report damaged equipment to your supervisor. Report all shocks immediately, even tingles. Never work around electricity when you or your surroundings are wet. Use ground fault circuit interrupters, GFCI, when available. Never disable the ground plug on a cord set or a piece of equipment. Never use 3-to-2 ground prong adapters. Keep cords away from heat and water. Don't run cords across walkways, under rugs, or through doorways. Don't use damaged outlets or adapters that let you plug extra cords into an outlet. Don't use any electrical device that blows a fuse, trips a circuit breaker, shocks, or appears damaged. Get the device repaired by a qualified individual. And finally, always follow the manufacturer's instructions when using electrical equipment. First aid is limited care for an illness or injury until trained medical attention can arrive. Never move a victim unless you are absolutely sure it will not make their injuries worse, or to not do so would make their injuries worse. Try and make the injured person comfortable. Always let trained medical personnel move an injured victim. Should first aid be required, you should be prepared. Know the correct phone numbers to call if the injury requires trained medical personnel. In most cases, this should be the nationwide 911 number. Know the locations of all first aid kits. If a person is bleeding, always wear protective equipment. Know the location of the nearest eye wash and emergency shower. Know who is certified in first aid at the facility. Report every accident or close call to your employer. You should always have a positive safety attitude and promote safety in your workplace. Your attitude is your first line of defense for safe work practices. Maintain a clean work environment to prevent slips and trips. Always wear the proper PPE required by your employer. Follow your employer's safety rules and procedures. If you don't understand, ask your supervisor. Always pay close attention to safety training. Ask your supervisor if you have any questions about equipment or procedure. This video program has been a brief introduction to a variety of workplace subjects you may encounter. Your employer should provide in-depth safety training on these and other significant hazards in your workplace.